Hello, my name is Sean Dinneen. I'm a consultant endocrinologist in Galway University Hospitals, and I lead the Diabetes Integrated Care Implementation Group as part of the Enhanced Community Care Programme in Saolta Community Healthcare West. Care for type 2 diabetes has traditionally been very hospital-oriented in our area. We have many patients with stable type 2 diabetes attending our hospital clinics who really don't need the input of the hospital-based team. The chronic disease management payment to our GP colleagues has, in the last 2 or 3 years, really transformed our approach to chronic disease management. And now we're seeing GPs and practice nurses very comfortable with managing type 2 diabetes. The Enhanced Community Care Programme of the HSE is a game changer for diabetes care in our area. We're now appointing community specialist teams, including clinical nurse specialists, dietitians, podiatrists, who will be implementing our model of care for type 2 diabetes in an integrated way, promoting diabetes prevention, self-management education, and high-quality care along the course of the disease. It will also enable us to implement our diabetic foot model of care and allow the hospital-based specialist team to concentrate on the complex end of the care pathway and dealing with people living with type 1 diabetes, technology, diabetes in pregnancy, and so on. So our team is not yet complete. Saolta, CHW are still, we're still in the recruitment process, in particular for consultant diabetologists to the Ballinasloe and Galway hubs, but we're very excited about the opportunity that ECC presents us. Thank you for your attention. I'm going to hand over now to members of the community specialist team and a service user.
A large part of my job within the hub really is organising and running the Desmond programme. So this is a structured self-management group education programme for anybody living with type 2 diabetes. I also run one-to-one clinics, and this is really for those with type 2 diabetes with more complex needs. For example, those with celiac disease, chronic kidney disease, but they have a background of type 2 diabetes. I also work very closely in a multidisciplinary team alongside my clinical nurse specialist and podiatry colleagues. So there would be overlap between our client lists, and essentially we're trying to just get best outcomes by working together with those clients.
I look after patients with type 2 diabetes, and GPs refer these patients to the service, and we accept patients who have a HbA1c of greater than 58 millimoles per mole. They're usually on 2 or more medications for their diabetes. They may also send them to my service for insulin initiation or medication titration, or perhaps they might have difficulty with hypoglycemia. As part of my role in the community, I am a Desmond educator. I work very closely with podiatrist and with dietitian. We're a diabetes team within the community. So this multidisciplinary approach and communication with the different healthcare professionals is key really to getting the best outcomes for patients.
I provide podiatry treatment to people with diabetes. As part of the service, I carry out full diabetic foot assessments, and this consists of a vascular assessment, and that's made up of a hands-only palpation of pulses, and I also use a Doppler to find the pedal pulses in the foot. I also carry out neurological assessment of the foot, and I also look at foot structure and footwear. An important part of the service is education, the importance of foot health protection, and we give general advice on foot care and footwear. After I first assess a patient, I send a letter just with the results of the diabetic foot assessment and with any treatment plan that's been agreed, and that's forwarded on to the GP.
I was diagnosed first in October 2020, and Dr. Enda suggested I come here as part of the service to engage with what I call my 3 Charlie's Angels. Since I started coming to them, what I felt was that because of their information that they gave me, because of the supportive nature and the friendliness that they portrayed to me, it helped me actually embrace the condition and work with them to become the healthiest version of myself that I am today. Because it's a local service where I didn't have to travel, because it was so friendly and supportive. I feel now, because of the positive experience, that I'm healthier and happier than I have been in years.